In this module, we'll be introducing the concept of evidence-based decision-making in dentistry. Evidence-based practice is an interdisciplinary approach to clinical practice that has been becoming more and more prevalent since its introduction in 1992. It started as evidence-based medicine and has spread to other fields such as dentistry, nursing, library science, information science, and many other fields. The American Dental Association has defined evidence-based dentistry as an approach to oral health care that requires the judicious integration of some major areas, including systematic assessments of clinically relevant scientific evidence relating to the patient's oral and medical condition and history, together with the dentist's clinical knowledge and expertise, and then including the patient's treatment needs and preferences. And these are all integrated together to make a good clinical decision and to practice solid clinical dentistry. There are 5 main steps in evidence-based dental practice. The first involves identifying a clinical question to be addressed. A well-formulated and focused clinical question should involve the population of interest, the intervention in question, the comparison intervention, and the outcome. A clearly stated clinical question is often done in what we call PICO format. This format identifies the population, which is the individuals or groups for whom an answer is sought, the intervention, which is the treatment or clinical condition of interest, the comparison, which is the alternative treatment or control group for comparison to the intervention, and the outcome, which is the measure or measures used to assess the effects of the intervention. So in the question you see here, the population is healthy adults. The intervention is daily brushing combined with daily flossing. The comparison is the treatment with daily brushing alone, that is with no daily flossing, and the outcomes are the effect on periodontal bone loss. So, you've asked a really good question. Where do we go to find the evidence that best answers this well thought out question? There are different types of evidence. This ranges from expert opinion all the way up to systematic reviews of all the available information. Levels of evidence is a ranking system used in evidence-based practice to describe the strength of the result measured in a clinical trial or research study. So levels of evidence can range from 1A, which is the highest, and something that you would see in a systematic review of randomized controlled trials, to 5, which is the lowest. So when a dentist says, oh, this filling material works really well in my hands, that's why I'm going to use it to fill these teeth, that's not the best evidence for making a clinical practice decision compared to a systematic review of all the literature that looks at comparisons of all filling materials out there. So in the next lecture cast, we'll be discussing the highest quality types of evidence that are used in evidence-based dentistry decision making.